Every year, 1,000 people on the East End of Long Island are told, you have cancer.
There is no life experience for a cancer diagnosis. None.
Your life literally is turned upside down.
You don't realize how many other people are out there going through the same thing.
Within 48 hours, 400 of them have contacted Fighting Chance. 6 of these patients described their experience in their own words, and Duncan Darrow, the founder of Fighting Chance, talks about the services Fighting Chance provides.
Part of what we've tried to do in this series is lift up the voice of the cancer patient.
It is a debilitating diagnosis. You don't prepare for the cancer diagnosis. I think you prepare for everything but the cancer diagnosis. I had a healthy lifestyle. I was living in Montauk. I worked outdoors, and I had stage 3 tonsil cancer at 47 years old. I went to my local physician. He says, I'm going to perform a tonsillectomy, and I'm going to send your tonsils to Sloan Kettering and Johns Hopkins. And at that point, I felt that a ton of bricks had fallen, because I told Dr. Davies, I said, Sloan Kettering is not a tonsil hospital. And he says, no, it's not.
I suppose statistically I'm as cured as anyone from my cancer. But then my son, who was at the time 16, he just didn't look well. He looked pale, and I thought, well, maybe he's coming down with a cold. The doctor looked him over, and his platelet count had fallen through the floor because of the leukemia that was diagnosed that night.
One night, the stomach pain got too intense, and we went by ambulance to Southampton Hospital, and the next day had an emergency colonoscopy. The following Monday, had emergency surgery and had the tumor in my colon removed. I was diagnosed with second stage colon cancer.
Actually, I was out walking one day, and all of a sudden I had terrible chest pain. I think I had a good idea to tell my cardiologist this happened, because I was worried that it might be a heart attack or something. And when I walked in there and saw his face, I knew something was wrong. And he said, it's gone active, whatever it is, it's gone active. And he didn't say cancer, but I knew it was. I knew that's what it was.
I found my lump. It was malignant, breast cancer stage 3. Honestly, there isn't a day that goes by that I don't hear of somebody that's been diagnosed with cancer.
My name is Bob Tepe, and I'm a pancreatic cancer survivor and really a cancer conqueror.
There are a lot of people in the world who just say, oh, the hell with this, it's too hard. I had just been diagnosed, so I was at sea. Okay. And I had hardly any idea where to turn, who to go to, nothing. I was at sea.
And Fighting Chance gave you a little guidance.
Yeah, it threw me a life preserver.
Duncan, when people first come to Fighting Chance, what's the first thing you do to try and help them?
Well, the first thing we try to do is to get them to snap out of that state of shock, to deal with that state of shock, because when you're in that mindset or that emotional distress, a couple things you just cannot do. You cannot process information the way you usually do with the same rapidity, and you lack confidence about making decisions. And needless to say, in a battle against cancer, you're going to have to do both of those things. And we have professional counselors, oncology social workers, clinical psychologists who specialize in doing that. It doesn't happen in 5 minutes. It may take several counseling sessions, but that's our first goal.
What about education? Is there a way to educate them about the disease?
As I said, most patients feel that if they know a little bit about the disease, Biology 101, they're going to feel a heck of a lot more in control. And what we typically do in that regard is we've got teaching tools, just like anyone would who's trying to educate you. And the teaching tool we use for that issue is Cancer Simplified, which is 44 flip charts. And it just takes a patient through the entire disease, what a cancer cell is, tells you where it starts, tells you how it spreads, and so forth. And patients feel much more empowered when they understand some of the basics of what's going on in their bodies.
So you can walk out of Fighting Chance knowing an awful lot more about your disease and what its ramifications are.
Yeah, but we won't let you leave without one more step, which is logistics.
Okay.
And so we have what we call a cancer patient navigator, coping with cancer on the East End, because when you have cancer, you are so stressed that you do not have the patience to wait for a number from information or to rummage through the yellow pages. It's that kind of waste of time and frustration that just drains you of energy you need to fight the disease.
The doctor recommended that I go see a surgeon, emphasizing that time was of the essence. And that's when panic set in, of course. I just had to do this right away. Now, I wouldn't say I went down blind alleys, but what I would say is that the roads that I went down to in speaking with surgeons, interviewing them, were, am I speaking to the right guy?
Because I had no idea what to do as far as medically goes. And I'd heard about chemotherapy, and that was scary. That was really scary. I think that scared me more than anything else.
He says, John, there's only one way to beat cancer the first time, and it's the first time. Take the chemo. It's not going to be pleasant, but take it. Chemo and radiation are cumulative. It starts out okay, but every day you take it is a cumulative effect. It's just building with radiation poisoning.
The cocktail they picked for me was Taxol and Herceptin.
3 months of chemotherapy.
8 weeks of radiation and chemotherapy.
About 18 months of chemo, almost daily.
Aggressive. If you took it all at once, it would kill you anyway.
Emergency colonoscopy.
He circulated all of the blood in his body through a machine.
A brain surgery, a fairly heavy dose of lung radiation.
And a few little other goodies that they put in.
I was traveling, round trip 220 miles every day for my radiation treatments.
I'd gone for a checkup. They did a PET scan and said, we think you have a recurrence.
Give you 6 weeks of chemo and radiation combined.
And to hear this was almost like a death sentence.
I am not going. I'm not going to have that needle jammed into my chest. I'm just not going to do it.
Don't ever give up. Don't ever even consider it.
And the side
One of the
effects,
things that I was really frightened of.
the lack of saliva, the lack of taste, the lack of appetite,
Severely sick once or
and
twice.
you're never hungry.
Food tasted like a lead pipe.
Lost 45 pounds.
Falling down and staggering around all over the place. And it was extremely frustrating to me.
It wears on you in every possible way, physically, emotionally, mentally.
You see all these physical things. You see the body do every unpleasant thing that it can do.
Physically, it is the worst flu you have ever had with the worst hangover at the same time. A very good friend of mine basically put it in black and white and said, John, you only have choice A. Choice B is grim. And I kept it very focused. That I have to do all these days, I have to ride in this car, I have to do this chemo, I have to have this feeding tube, I have to be sick. This is it. This is choice A, because the other is unacceptable.
I think when I saw the light at the end of the tunnel was maybe when I was at round number 10 out of 12, when I thought, you know what, this is not going to be the rest of my life, because it felt like a lifetime on chemo.
I'm not going to turn away from the chemo because the chemo has saved my life. I like the chemo. The chemo is my friend. When I started to do the lung radiation, he said, we're going to stop the chemo during the lung radiation. And I challenged him on it. I said, why? He said, it's too heavy a load. And I just looked him right in the eye and I just said, no, it isn't.
I did have a difficult time, but when you have an organization like Fighting Chance, if I were to have a bad day, or if I was thinking of stopping, I could pick up the phone and call Heather. I could go to the office and talk to Kerry on a one-to-one. And those were the difficult times where people like Heather and Kerry really help you get over that hump until you pick yourself back up.